Dr. Olsen.
Oh, hey Alexa, how's it going?
It's going pretty good. I have a question
Awesome.
for you.
You do?
I do.
Awesome.
It's been burning, ready to ask it.
I love questions. Just let me put this away. You have my full attention.
Amazing.
What is your question today?
So I really want to know about NET.
NET. Do you know what NET is?
No, I'm not
NET
familiar.
stands for neuro-emotional technique. So it's a technique developed by a Dr. Scott Walker about 30 years ago. And what it is doing, it's looking at the identifying and resolving unresolved emotional traumas that store in your subconscious. So
what does that mean exactly?
in English,
Yes.
the emotions that you experience store, and your body can experience things that are like them and cause that unresolved trauma to reoccur, re-experience with you, for you, in your body, in your emotions, in your, basically in that capacity.
So if it's something that can happen in my body and I'm holding on to it, what kind of impact can that actually have on me?
Well, if I can share a story with you, one that comes to mind recently is, there was a patient coming in, and she was visiting her mom. And her mom and her would kind of butt heads. And it was impacting her care, because she was basically stressing out during this, not only just her care, but also her quality of life, her ability to heal. And so we started to do some checks for these, what's called neuro-emotional complexes, which is when we identify this is happening in the body. And so we checked, and we did identify that she had some of these neuro-emotional complexes. We went through the process of called neuro-emotional technique, and we began to clear them out. I think it was about this second week. We'd done a few treatments, and she came in, and she was like, I went to see my mom today. And she had a smile on her face this time.
Wow.
Because she went to see her mom, and she wasn't being triggered. So she wasn't having that subconscious triggering that was happening, so her body was not going into it. Now, what I've seen is the way that this can impact things is, one, there's that saying, we can't change other people. We can only change ourselves. You may have experienced this or seen it, but oftentimes somebody will say something to you or give you a look or a tone of voice, and all of a sudden you have something that kind of twists inside of you. And then your body changes, and then you have an expression, and then they see it and they have an expression. All of a sudden you have this tension going on. So, but what would happen if, when that person did that, you didn't respond?
I'd be a lot happier.
You would be a lot happier. And then
Less stress.
Then if you didn't respond, they wouldn't respond. So by the nature of this, it tends to change that dynamic, that relationship of what happens in relationships internally, with how you can have conversations with yourself, relationships with food, relationships with job, other things that you do. Any of these things are possibilities. So, did your jaw just drop?
Did a little bit. What about something like if I've had pain, but I really can't find like a source? Is that something that NET might be able to help with as well?
Yeah, there's absolutely emotionally driven pain. So that's partly how this was originally developed. Dr. Scott Walker is a chiropractor, and a lot of chiropractic is about different types of musculoskeletal pain. And so he did his research, put together these different things, and started testing the responses with this, and started seeing that people's physical pain would get better when he did this. Then as it continued on, he taught it, and more people did it. We began to see greater applications with regard to it. And so there's actually another fun story. I got called out to a location one time. There was a gentleman, and he was on the floor, and he could not move. And so I left the office, I drove over to the location, and sure enough, he was on the floor. And he's like, Doc, I can't move. And so I doing some of my checks with him, and I can't find anything physical going on with him. So I check emotions, and boom, there it is. So we found the neuroemotional complex, and it was a long time ago, I don't remember how many that I cleared, but we cleared, say, 4, 5, 6 of them, and then it showed that he was done. So I said, go ahead and get up. And he gave me a look of like, what do you mean? You didn't do anything.
Oh my gosh.
So he gave it a try and boom, got up, stood up, and moved around. He's like, oh my gosh. Without any hands-on touching of his body other than correcting the neuroemotional complex through NET.
That's amazing. So how does NET work then? How do you actually clear those emotions?
So NET has connections from in Chinese medicine. And what Dr. Walker did was he actually found correlations between the Chinese medicine concept that each organ in the body stores emotions, and then each organ has a vertebral sequence with it. And each organ also has a meridian associated with it. So there's two different types of corrections. As a chiropractor, we'll do a spinal, basically tap or adjustment over the vertebral levels associated with the organ, or it can also be done by using acupuncture points associated with that, either typically on the wrist, but it can also be applied at what we call beginning and end points that could be on the face, or just different ways of applying it. But so essentially, if we found one with you, we would identify what it was at what we call an access point. What's bringing it up right now? And then we trace it back and find out with your body memory, what was the original event with this? When did it originally happen? Was it 3, 4, 5, 10, 11, 12, whatever that age was? Because if we correct it just at the current time, then we didn't get rid of the original one. So if you experience it again, your body's going to experience it again, okay? That's why we trace it back to the original trigger, what we call a neuroemotional complex, okay? And once we go back to that age, we'll then have you hold the picture. We contact to the emotional points and the organ points, and then you'll do a breath in and a breath out while we do the tapping or adjusting on the spine over the vertebral sequence, and that helps to reset the nervous system related to that. Now, I just have to add that if I was listening to this, I might be kind of going, that sounds like a little wild.
Definitely.
And there are a lot of times where things happen clinically and we don't necessarily have correlations with them, but it was fantastic that the research part of neuroemotional technique called the One Foundation was actually able to fund a study where they did a functional MRI, which measures the activity in the brain. And they found that with the patient they did this with, they found the neuroemotional complex, that unresolved emotional trauma. They had that person hold it, and they found an area of the brain lit up called the perihippocampus, which is where unresolved emotional trauma processes. And then they did the treatment, and then they came back and they said, now hold that same picture that you had before. And when they did, the brain didn't light up.
Wow. So
it changes the way that your brain functions and responds and reacts. Just like those two different things. It could be those aspects of a relationship, again, relationship with somebody else. It could be a relationship with yourself, relationship with food. It could be the relationship with your body, as in pain or different types of dysfunction. So it's not uncommon for somebody to come in with digestive issues, and I will do an abdominal palpation over the intestinal tract. We'll find pain and discomfort. And again, there can be a variety of reasons that can be occurring, but I'll have them give a number on the level of pain, and if there is an emotional connection, we'll do the emotion or emotions associated with it, and we'll come back and recheck. And it happens virtually every time that we do this. We go back and the stomach is now non-tender, it's more pliable, and literally they were storing that emotion in their intestinal tract, affecting their digestion. So
it sounds like this has an immediate benefit.
Yes, both immediate and longer term, because when you no longer react to these things in your life, your brain can calm down.
And calm down your nervous system.
And calm down your brain, calm down your nervous system, absolutely. And then outside of that internal part, if you have person, place, thing, or event in your life and your brain's no longer going boop, boop, and firing on those, then you start to feel like you have some sanity back.
Don't we all need a little of that?
We all need some more sanity, yes. So, it's just an amazing tool. And, there's times where I reference that, if I was to have only, 2 or 3 things that I could do in practice, this would be one of them. It's so impactful. I've seen so many changes with regard to it that it is an essential. So, yes.
So how would I know if NET might be a right fit for me?
Well, one, you can get tested. Two is if you have areas in your life, with a pain standpoint, you can't really know really unless you get tested. You might find that there's times like you notice like a discomfort or something happens when you're around somebody or in a particular situation. That certainly could be emotions. Okay, so people sometimes can get, I'll say, in stressful situations, and they might notice that their shoulder's off, or the next day they don't go to the bathroom because of that emotional impact related to it. And that could just be overactivation of the nervous system, but it could be an emotional trigger that could get better if it was resolved. So
makes a lot of sense.